Complex lipids are constantly being synthesized and decomposed in the body. In several genetic diseases, some of the enzymes needed to decompose the complex lipids are defective or missing. As a consequence, the complex lipids accumulate and cause an enlarged liver and spleen, mental retardation, blindness, and, in certain cases, early death. First is autosomal recessive inheritance. It occurs when both parents carry and pass on a copy of the faulty gene, but none of the parents show symptoms of disease. X-linked recessive inheritance occurs when the mother carries the affected gene on the X chromosome that determines the child's gender and passes it to her son, daughter.
Gaucher disease is the most common of the lysosomal storage diseases. It's a rare inherited disorder resulting from a deficiency of the lysosomal enzyme glucocerebrosidase. Glucocerebrosidase is produced in the endoplasmic reticulum of the cell and transported via the Golgi apparatus to the lysosomes. Once there, it catalyzes the breakdown of its main substrate, glucocerebroside, into glucose and ceramide. Glucocerebroside is the building block for 90% of glycosphingolipids that are found in the plasma cell membrane and are essential for vital cellular activities. Deficiency of glucocerebrosidase leads to the lysosomal accumulation of glucocerebroside, predominantly within macrophages and macrophage-like cells. Macrophages laden with excess glucocerebroside are known as Gaucher cells and have a characteristic appearance. Accumulation of Gaucher cells in the liver, spleen and bone marrow gives rise to the typical clinical manifestations of Gaucher disease. Gaucher cells also secrete cytokines, which can contribute to the signs and symptoms of disease.
This picmonic describes Niemann-Pick disease, portrayed by a pick in the man's knee. This is an autosomal recessive disorder described by the recessive chocolate, which is caused by a deficiency of the enzyme sphingomyelinase, shown by the broken sphinx on my leg. Niemann-Pick disease is more common in the Ashkenazi Jewish population, represented by the yarmulke. Signs and symptoms of this disease include a cherry red macula, which can be visualized on fundoscopic exam, depicted here by the cherry eyes. Hepatosplenomegaly can also be appreciated on physical exam, shown by the liver and spleen balloons, due to the accumulation of sphingomyelin and other lipids in these organs. Patients also display neurodegeneration, illustrated by his degenerating nerve arm. On histologic exam, Niemann-Pick disease can be diagnosed by the visualization of foam cells, represented by the foam from the man's mouth. So to recap, Niemann-Pick disease is an autosomal recessive disorder which is caused by a sphingomyelinase deficiency and has an increased prevalence in Jewish populations. A cherry red macula can be seen on fundoscopic exam. Patients may display hepatosplenomegaly and neurodegeneration. Foam cells are a diagnostic finding seen on histologic exam.
Tay-Sachs disease. What is it? Tay-Sachs is a disease that is usually found in young children, although there are rare juvenile and adult cases. Symptoms appear in seemingly healthy infants at approximately 3 to 6 months of age. It is always fatal. Primary symptoms include rapidly declining development, weakening of muscles, and loss of motor skills. These are followed by increased startle reflex, blindness, deafness, inability to swallow or chew, mental retardation, paralysis, and dementia. This is followed by death at age 4 or 5. How does this happen? It starts as a defective gene on chromosome 15. It affects the body's production of hexosaminidase, which is a very important protein that breaks down a chemical in our bodies called gangliosids. The gangliosids then build up in the brain and in time cause death. The Tay-Sachs gene is recessive, so it is possible to be a carrier. For a child to be born with the disease, Both parents must be carriers.
What is Fabry disease? Fabry disease is an X-linked lysosomal storage disorder. Mutations of the X chromosome result in deficiency of the lysosomal enzyme alpha-galactosidase A. Lysosomes function as the recycling centers of the cell. They contain digestive enzymes that break down substances into smaller compounds. Deficiency in this enzyme results in progressive accumulation of globotriaosylceramide in lysosomes, leading to organ damage and premature death in men and women. This disease causes progressive damage to different organs and tissues. As this is a rare disease, with such a wide range of symptoms, it is frequently misdiagnosed. Genetic inheritance. As the condition is caused by a DNA mutation, it is a genetic disease and therefore hereditary. Fabry disease is an X-linked disease, which means that transmission is linked to gender as follows. As family members may be affected, even if they don't have obvious symptoms, it is very important to perform pedigree analysis and test relatives for Fabry disease.
What is Krabbe disease? In 1916, a Danish neurologist named Knud H. Krabbe first diagnosed the rare metabolic disorder that has since become commonly known as Krabbe disease. It also goes by the name globoid cell leukodystrophy, or galactosylceramide lipidosis. Krabbe is an autosomal recessive disease. Though a child with Krabbe disease has a genetic abnormality on chromosome 14, they usually appear completely healthy at birth, and often for several months or even years. However, their body is not producing an essential enzyme called galactocerebrosidase, or GAL-C. GAL-C is necessary to break down and metabolize toxic substances in nerve tissue. A deficiency in GAL-C results in toxic buildup. Psychosine, in particular, is a destructive toxin that accumulates in the brain. As psychosine builds up in the nerve tissue, it begins to destroy the myelin sheath, which covers and insulates the nerves. This process is called demyelination. Demyelination distorts brain messages. It inhibits the transmission of nerve impulses. This hinders the brain's communication with the body, resulting in disability. As psychosine continues to build up in the nerve tissue and progressively destroys the myelin, disabilities increase. The brain becomes unable to control the body, including motion, vision, speech, and critical life functions, eventually leading to death.